Hi guys! I kind of feel like I need to do a video because I freaked everybody out by saying I had a blood clot this morning, which it's true. I do have a subclavian blood clot, which is right here. Can you see that gross little thing right there inside of me? That's my port. Anyway, I got a blood clot about an inch big right by my port, and obviously they didn't hospitalize me. Like, I didn't have to stay at the hospital, which is awesome. They just did the ultrasound and like gave me a plan going forward, and I'm just gonna be on blood thinners for like 3 months. So everyone's like, whoa, how'd you get a blood clot? What happened? Chemo can cause blood clots. I was on a drug called Tamoxifen that can cause blood clots. So, and we also have clotting history in my family. Just like breast cancer, we have awesome genes. So yeah, can't have it all. So anyhow, so yeah, of course I was bound to get a blood clot since it runs in my family. But anyhow, I was joking about the cookies and the donuts and the meals that I am going to need for the next week or two. I mean, I want your donuts and your cookies, but I don't need them. I am fine. And besides, I mean, my arm already swelled up to like 10 times its normal size. You're all going, whatever, that's the size it always looks, but I promise it's way bigger. It's like seriously like an inch or two bigger than normal. I even measured, and this arm is an inch smaller than this arm. But anyway, it was so crazy. I'd kind of noticed for a couple days it was getting like tingly and felt a little swollen and weird looking, and like it was like a little bit darker than my left arm. Anyways, and I went swimming this morning, and holy cow, it was purple, blue, green, this funny color, and twice the size of my other arm. In fact, the lady swimming next to me was like, looks like you're having some circulation issues. I'm like, yeah, I think so. I was like, oh my gosh, I'm dying. Anyhow, so that's what made me go to the doctor. I mean, I thought maybe I had like lymphedema from my mastectomy. But anyhow, I don't want it to be a blood clot, but I also don't want it to be lymphedema, so I'm glad it's a blood clot. But anyhow, other than that, things have been going good. I haven't done an update for a while because, sorry, my hair just looked funny for a second. I haven't done an update for a while because there really wasn't anything to update. Those of you who follow me on Instagram or Facebook have seen that I've been out biking, skiing, living my life, having fun, and I really haven't had any complaints when it comes to the cancer. So this was just totally random and out of the blue. But I will say, I did have to start taking a drug called Tamoxifen, which is a hormone blocker, which for people who are premenopausal, who have hormone-fed breast cancer, estrogen, progesterone, and HER2 positive breast cancers, they take this Tamoxifen for 5 to 10 years after treatment. Anyhow, kind of like to prevent the cancer coming back. I had to start taking that on February 1st, and I would be lying to you if I did not say that I hate it. I hate everything about it, hated it. And then I felt like a baby for hating it, but like it caused me to have like super bad acne, and I've always had good skin, and like, man, my face like broke out like crazy. And then it caused weight gain. I felt moody. I felt like my stomach felt weird on it. Not nauseous, but just like weird. Muscle pain, just like my legs felt swollen all the time. I was just like, and then like the psychological stuff that comes from that, like this makes me feel miserable. And so I was just like, I don't want to take this. So I stopped taking it a couple days ago, which is probably a good thing because it caused my blood clot. But anyhow, I'm sure my doctor is not too happy about that. He found out that I stopped taking it today. So anyhow, I told them, give me a couple months and then we'll discuss a plan going forward. But I'm not a big fan of being on drugs. I know that they're good and they're wonderful and they obviously save lives, but man, I also hate them at the same time, the other side effects. But anyway, that's neither here nor there. But other than that, things have been good. So just, yeah, taking Tamoxifen, and I had capsular contracture in my right implant, which is basically hardening scar tissue and hardening of the implant because of the scar tissue, I mean. So anyhow, I've had to like do some massage therapy to try to work that out. And if you can't work it out, you have to have the implant removed. But I'm feeling like I'm seeing some improvement. So hopefully I won't have to have any more surgeries on my implants. So that would be good. But other than that, things are great. Life is good. Can't complain. Well, I mean, I guess I could, but then I'd feel really guilty when I see other people with problems. In fact, I ran into my friend at the store while I was picking up my blood thinner prescription, and she was telling me about her other friend who has vision problems because of blood clots in her eyes or something crazy. And I just was like, I will never complain again. So anyhow, you can always find someone who has it worse than you, right? So anyhow, things are good. I've missed you all. so much. Just kidding. But I have. Anyways, have a great day, and I will talk to you later. Bye.